father died when I was 10 from AIDS, and then my mother died when I was 15 from AIDS as well. Myself then, I turned to alcohol and drugs and after my mother died. And now I don't need that anymore.
I thought I was never getting out. I didn't care about life. Life had no value. You know, I just thought I was going to die in jazz, and that's it, so why should I do anything? So this could turn my life around. Little did I know, that was my future.
The project CBHFA in prisons began in Wheatfield Prison in 2009. In a prison, you've got a healthcare department, but you've got nothing between the healthcare department and the community. Now, the local community in a prison are the prisoners themselves. There was poor practices, poor hygiene throughout the whole prison. Prisoners went to the surgery when they were sick, but nobody went to learn about how to live a better and healthier life. What we needed was something which created action and empowerment in the community.
Hello, we're doing rapid HIV testing. Red Cross, would you be interested? 20 minutes.
This project wasn't without its risks, it wasn't without its challenges. And at the outset there was this, for us, critical issue of what status do we give people within the prison who want to be volunteers.
In any prison there are going to be skeptics who feel that empowerment of prisoners might be a dangerous thing.
Who could argue that if people wanted to do good work within the prison community that we shouldn't find a formula to enable them?
There's an officer's desk there just sitting in the middle of the floor with a couple of chairs around them. That's a hazard for people walking.
So what I was doing was talking to each part of the system to see how they themselves in their department could flourish because of this.
You can't be done without partnership working, and that means that you have to give up some of the old territorial approaches and actually pitch in with the Red Cross, the National Red Cross, with the education services, with the prison service buying in, but most importantly, the prisoner actually buying into a vision of actually developing the program.
So I'm just going to measure your blood pressure now. How are you doing? Do you go to the gym much or anything?
Graham came in and he says, would you like to join the Irish Red Cross? And he says, what in the hell is the Irish Red Cross? What's that got to do? I heard them being in war zone, but there's no war over here. No, he said, it's different. What I noticed with them, they listened to you, they didn't tell you what to do. So then I started the first aid course.
It was me against them. Do you know what I mean? Like they're on one side of the fence and I'm on the other side, and there was no climbing over that fence. But when I joined the Red Cross, that fence got taken down.
You don't call them prisoners anymore, you call them volunteers. So they're on the journey to reform and to change.
The simplest thing to start off with are simple health awareness projects that change the environment to be a healthier place. For example, the same bucket and the same mop is used for all parts of the prison, which is unhealthy, unclean. So a simple project is to get colour-coded mop and bucket systems. Just something as simple as that creates a great deal of satisfaction among prisoners and indeed prison governors who see that the place is a cleaner area.
Prisoners who have a lot of time on their hands, traditionally doing very little work, very little education, actually volunteering to give of their time to help other people with their healthcare needs, with safety needs.
We implemented it as a pilot in one particular prison, and having seen the impact of that, we then moved to another prison, and so now it's in 10 out of 14 prisons, and next year it will be in all 14 prisons. Governors are telling me that the prisons are calmer. There are less fights. There's less violence.
The most challenging one was the weapon amnesty project that the volunteers got involved in.
The majority of prisoners carried homemade weapons. The violence was escalating, not only in the number of assaults but also in the viciousness of those assaults. Our statistics show that up to the point that we call the amnesty, 97% of our assaults had a weapon used. 97%. On our last quarter, we had reversed that. 6% of our assaults were using a weapon.
It's a win-win situation. There's less tension in the jail. That was the main thing. And believe it or not, it broke down the barriers with the staff as well. And that's something, as I said, for the Irish Red Cross to be proud of. That never happened in the jail before. You're saving staff or medics. You're saving people going to the hospital. It's a massive cut out of budget.
This is a good idea. You know, we have benefited hugely. We have a safer prison, a more secure prison, and I can work within budgets.
The volunteers are like a catalyst to encourage people to come and better themselves. And through that, I would say that a number of them will leave this prison and they won't come back again. And I believe that's down to the type of empowerment that's happened during this programme, which is a key feature of it.
Coming to prison and joining the Red Cross made me realise what life was really about. Gave me a lot of hope.